If you are waking up 1, 2, 3 times a night to use the bathroom, I need you to hear this clearly. In most cases, the problem is not your bladder. It is not your prostate. It is not your age. It is when and how you are drinking water during the day. And once I show you what is actually happening inside your body between dinner and midnight, you will never think about hydration the same way again. My name is Dr. Miles Parker. I'm a urologist. I finished my residency at 28, and I've now spent 7 years in clinical practice focused specifically on bladder function and lower urinary tract issues. I am 35 years old, and I want to be transparent about something. When I first started seeing patients in their 50s, 60s, and 70s who were exhausted from broken sleep because of nighttime urination, I assumed the answer was always clinical: medication, a procedure, something in the anatomy. What I learned over thousands of patient consultations is that in the majority of cases, not all, but the majority, the answer was behavioral. Specifically, it was about water, how much, what kind, and most critically, when. This video is about the when, because the when is the part nobody talks about, and the when is the part that is ruining your sleep. Let me start with what is actually happening in your body at night, because you cannot fix something you do not understand. Your body runs on a 24-hour internal clock. You know this as your circadian rhythm. What most people do not know is that your kidneys run on this clock too. During the day, your kidneys filter blood at a relatively high rate and produce urine continuously. That is normal. That is what they are supposed to do. But in a healthy circadian cycle, as evening approaches and you move towards sleep, your body releases a hormone called antidiuretic hormone, ADH, also called vasopressin. This hormone signals your kidneys to slow down urine production at night. The kidneys concentrate the urine rather than producing large volumes of it. This is why, in a young healthy person with a well-functioning circadian rhythm, you can sleep 8 hours without a single bathroom trip. The body has an internal off switch for nighttime urine production. Here is what disrupts that off switch. The single biggest disruptor, in my clinical experience, is a pattern I see in almost every patient who complains of waking 2 or more times per night. I call it the compensation flood, and it works like this. The patient wakes up, goes about their day, drinks very little water in the morning and afternoon, often because they are busy, or because they do not feel thirsty, or because they are worried about having to use the bathroom in public or while driving. They arrive at dinner mildly to moderately dehydrated. Then, in the 3 to 4 hours between dinner and bedtime, they drink the majority of their daily fluid intake. A large glass of water with dinner, another while watching television, maybe a cup of herbal tea before bed, because they've heard it helps them relax. They have essentially compressed 6 to 8 hours of hydration into 3 hours. And then they lie down and wonder why their bladder wakes them at 2 in the morning. What has happened is this. The kidneys received a large late fluid load at exactly the moment they were preparing to slow down for the night. The ADH signal is trying to reduce urine production, but there is too much fluid arriving too late for the kidneys to process quietly. The off switch is being overwhelmed by the sheer volume of incoming fluid. The kidneys have no choice but to produce urine. The bladder fills and you wake up. Not because your bladder is broken, because you handed your kidneys an impossible task at the wrong time of day. Think of it like a dishwasher. You run your household all day. Dishes accumulate in the sink, and then at 10 o'clock at night, you load the dishwasher and run it. The noise wakes everyone up. The problem is not the dishwasher. The problem is that you waited all day and did the work at night. If you had run it at noon, the house would be quiet by bedtime. Your kidneys work the same way. Give them the fluid load during the hours they are built to handle it, and they will be finished with the heavy work long before you turn off the light. Now let me give you the framework I give my patients. I call it front-loading, and it is the single most effective behavioral change I have seen produce results in people with nocturia, the medical term for nighttime urination, who do not have an underlying anatomical or neurological cause. Front-loading means distributing the majority of your daily fluid intake in the first 2/3 of your waking day. If you wake at 7 in the morning and go to bed at 10 at night, that is 15 waking hours. Front-loading means drinking the bulk of your water between 7 in the morning and approximately 3 or 4 in the afternoon. The final third of your day, roughly 4 in the afternoon to bedtime, is when you begin tapering your fluid intake down deliberately and progressively. Let me make this concrete, because I know abstract frameworks are not what you came here for. When you wake up in the morning, before coffee, before breakfast, drink a full glass of water, 8 to 12 ounces. Your body is mildly dehydrated from the night, and giving it water first thing does several things simultaneously. Kickstarts kidney function for the day, it supports bowel regularity, and it begins filling your hydration account first thing in the morning rather than leaving it empty until evening. Between waking and noon, aim to drink roughly half of your total daily water intake. For most adults, total daily intake should be around 6 to 8 glasses, so by noon, you want to have had 3 to 4. This does not mean chugging water. It means keeping a glass nearby, sipping consistently, staying ahead of thirst rather than chasing it. Between noon and 3 or 4 in the afternoon, continue drinking normally. Another 2 to 3 glasses across these hours? By late afternoon, you should be close to fully hydrated. Your kidneys have been processing fluid all day during the hours they are most efficient. The heavy work is done. From 4 in the afternoon onward, begin intentionally tapering, not eliminating tapering. You can still drink. You should still drink if you are genuinely thirsty. But the days of pouring a large glass of water at 9 at night and considering that responsible hydration are over. A small glass with dinner is fine, a few sips before bed if needed. But the days of the compensation flood end today. I had a patient, 61 years old, high school football coach, came in convinced he needed a procedure. He had been waking 3 times a night for 2 years. He was exhausted. His marriage was strained because his waking was waking his wife too. He had already seen another physician who had mentioned the possibility of medication, and he came to me for a second opinion before committing to anything pharmaceutical. I asked him to walk me through exactly what he drank on a typical day. He thought about it and said, "Honestly, doc, I'm so busy during the day, I probably drink 1, maybe 2 glasses before dinner. Then I have water with dinner, usually a big glass, maybe 2. And my wife makes chamomile tea at night, so I have a cup of that before bed." I did not prescribe him anything. I drew out the front-loading framework on a piece of paper, told him to try it for 3 weeks, and asked him to text my office with what happened. 2.5 weeks later, his wife called to thank me. He had gone from 3 waking episodes per night to 1, and that one was moving towards 0 by the end of the 3rd week. Same bladder, same prostate, same age. It all comes down to different timing. Now I want to address 3 specific things that I see derailing people who try to fix nocturia on their own. Because knowing the framework is not enough if you are accidentally undermining it. The first is coffee and alcohol in the evening. Both are diuretics. They actively promote urine production rather than simply adding to fluid volume. A glass of wine with dinner or a coffee after your meal is not just adding liquid to your system. It is telling your kidneys to produce more urine than they otherwise would from that same volume of fluid. If you are waking at night and you are having alcohol or caffeine in the evening, you are fighting against yourself. I am not telling you to give up a glass of wine at dinner forever. I am telling you to understand what it costs and decide consciously whether that cost is worth the broken sleep. The second is high-sodium food at dinner. Salt causes your body to retain fluid and then release it over the hours that follow. A high-sodium dinner, takeout, canned food, processed meat, restaurant food where salt is used liberally, creates a delayed fluid release that lands squarely in your sleeping hours. This is one reason so many people find that they sleep better on nights when they cooked a simple dinner at home, compared to nights when they had restaurant food. It is not imagination. It is sodium driving a fluid release at midnight. Reducing sodium at dinner is not just a heart health recommendation. It is a sleep recommendation. The third is the bladder training trap. Many people, particularly those who have been waking at night for years, develop a habit loop that perpetuates the problem even after the physical cause is addressed. The bladder learns. If you have been waking at 2 a.m. for 3 years, your bladder has been trained to signal urgency at 2 a.m. regardless of how full it actually is. This is called a conditioned voiding response. When you implement front-loading and your fluid distribution improves, your kidneys will produce less urine at night, but your bladder may still wake you out of habit for several weeks. This is normal. This is not the treatment failing. This is the last echo of a pattern that is already breaking. Most of my patients see this habit loop fade within 4 to 6 weeks of consistent front-loading. Stay the course. I also want to spend a moment on something that does not get discussed enough in the context of nighttime urination, which is the quality of the water you are drinking, specifically, its mineral content. Plain, filtered water is fine, but if you are drinking large volumes of very low mineral water, the kind with virtually no dissolved solids, some reverse osmosis systems strip water down to near zero. Your kidneys can actually be working harder to maintain electrolyte balance, which affects fluid retention and urination patterns. A small pinch of sea salt in your morning water, or choosing a mineral water with naturally occurring electrolytes for some of your daily intake, supports the kidneys in processing fluid efficiently without the electrolyte-chasing effect. This is not a major intervention, it is a detail. But in my practice, details are often what separate patients who get 80% better from patients who get 100% better. Now let me also be direct about when this is not enough, because I want you to trust me. And that means I cannot tell you that water timing fixes everything. If you are a man over 55, and you have been waking more than twice a night for longer than 3 months, an enlarged prostate, benign prostatic hyperplasia, may be contributing to your symptoms. The bladder sits directly on top of the prostate, and even a modestly enlarged prostate can reduce bladder capacity and increase urgency. Front-loading will still help you, but it may not be the complete answer, and you deserve a proper evaluation. If you are a woman, and you are experiencing leakage alongside the nighttime waking, pelvic floor dysfunction may be a contributing factor that no water timing strategy will fully address. A pelvic floor physiotherapist is one of the most underutilized resources in women's health, and I refer to them regularly. If you have been diagnosed with heart failure, kidney disease, or diabetes, all of which directly affect fluid balance and kidney function, the front-loading framework still applies in broad principle, but your specific fluid targets and timing should be discussed with your physician before you make changes, because the underlying condition changes the parameters. For everyone else, the majority of you watching this who are simply tired, frustrated, and convinced that broken sleep is just something you have to accept as part of getting older, I want to be clear with you. It is not. What you are experiencing in most cases is a scheduling problem, not a medical problem. Your body is capable of sleeping through the night. Your kidneys are capable of quieting down after dark. Your bladder is capable of holding what it needs to hold. You just need to stop flooding the system at the wrong time of day and then wondering why it overflows at night. Here is what I want you to do tomorrow. Just tomorrow, one day. Drink a full glass of water when you wake up. Keep a glass nearby all morning. Have another with lunch. By 3 in the afternoon, make sure you have had most of your water for the day. Then taper. Small amounts with dinner. A few sips before bed if you need them. Nothing more. Just do that one day. Then do it the next. Give it 3 weeks before you judge it, because your bladder's habit loop needs time to unlearn what it has spent years learning. You are not broken. You are just watering the garden at midnight and wondering why it's wet. If this made sense to you, if something clicked, share it with someone whose sleep is being stolen from them the same way. A partner who gets woken every time you get up. A parent who has stopped traveling because of this problem. A friend who mentioned it once and you didn't know what to tell them. Now you do. I'm Dr. Miles Parker. Sleep is not a luxury. Protect it. I'll see you in the next one.